class, I recognize many of you have not dealt specifically with ethical sports-related dilemmas. Let me share with you some basic information. Many drugs that were intended to treat real health issues have been co-opted for illicit by elite athletes in order to improve performance. For example, anabolic steroids were originally used to treat a variety of medical conditions. However, because of their antibiotic properties, athletes began to use them to increase their body strength, muscle mass, and endurance, despite warnings from the medical community about dangerous side effects, including high blood pressure, thickening of heart valves, decreased fertility, libido, and stroke. Athletes still continue to use them. Steroids have also been known to cause chest hair on women and shrunken testicles on men. You would think that that would be enough to deter people. Steroids were first used to stimulate weight gain in patients who were severely underweight. They are a popular illicit drug for elite athletes because the combination of steroids and strength training can lead to a 38% increase in men and perhaps higher percentages in women. Other drugs given to athletes include testosterone creams to enhance muscle recovery, a narcolepsy drug which is used to increase mental alertness and reaction to time, as well as hormones to increase red blood cells, and a thyroid hormone to decrease sluggishness, to name just a few. Doctors Anderson and Johnson have studied the competing loyalties sports doctors have when treating illicit athlete patients due to the pressure put on them by athletes, coaches, team management, and owners. What complicates things even more is that in a professional sport where millions of dollars are at stake, team doctors are expected to produce results. The profits of winning teams translates into millions for owners, coaches, and players. As expectations of winnings grow, the pressure intensifies for medical professionals to deviate from what might be in the best interest of their patients. Sports doctors, especially those working with elite athletes or a winning team, will be asked to rehabilitate, inject, operate when they believe it is not medically necessary or not even in the patient's best interest. These competing loyalties threaten the independence and professionalism of the doctors who risk losing their position if they do not comply. I hope you consider these facts helpful when confronted with athletes. So far, class, I think this has been a wonderful examination of ethics. Up next, we have Woody and his client, Ed.